Genital herpes is a common sexually transmitted infection or STI. It affects millions of people worldwide, making it one of the most prevalent STIs. Despite its commonality, there is still a lot of stigma and misinformation surrounding it. It's caused by the herpes simplex virus known as HSV. This virus is highly contagious and can be transmitted through direct skin-to-skin contact, often during sexual activity. There are two types of HSV that can cause genital herpes, HSV1 and HSV2. This virus causes sores and blisters around the genitals. These sores can be painful and may take a few weeks to heal. The first outbreak is usually the most severe, and subsequent outbreaks tend to be milder. Genital herpes is a lifelong condition. Once infected, the virus remains in the body and can reactivate at any time, leading to recurrent outbreaks. However, the frequency and severity of these outbreaks can vary greatly from person to person. However, outbreaks can be managed and prevented with treatment. Antiviral medications can help reduce the severity and frequency of outbreaks, and some people may take these medications daily to prevent outbreaks altogether. There are two types of HSV that can cause genital herpes. HSV1 is typically associated with oral herpes, which causes cold sores around the mouth, but it can also cause genital herpes through oral genital contact. HSV2 is more commonly associated with genital herpes. These are HSV1 and HSV2. Both types can cause similar symptoms, including sores, itching, and discomfort. It's important to understand the type of HSV causing the infection, as it can influence treatment and management strategies. Both types can cause similar symptoms. These symptoms can include painful sores, itching, and discomfort in the genital area. Some people may also experience flu-like symptoms during an outbreak, such as fever, body aches, and swollen lymph nodes. Understanding the difference between them is important for diagnosis and treatment discussions with your doctor. Accurate diagnosis can help tailor the treatment plan to better manage the condition and reduce the risk of transmission to others. Genital herpes is very common. It's estimated that millions of people around the world have it, and many may not even know they are infected because they have mild or no symptoms. Millions of people around the world have it. The prevalence of genital herpes highlights the importance of education and awareness to reduce stigma and promote understanding. It's important to remember that having herpes doesn't make you a bad person. It's a common infection that many people live with. With proper management and support, individuals with genital herpes can lead healthy and fulfilling lives. It's a common infection that many people live with. By staying informed and seeking appropriate medical care, those affected can manage their symptoms effectively and maintain a good quality of life. HSV1 is the virus that typically causes oral herpes. This is also known as cold sores or fever blisters. These usually appear around the mouth. However, HSV1 can also be transmitted to the genitals through oral sex. HSV2 is the virus that most commonly causes genital herpes. It is usually spread through sexual contact. This includes vaginal, anal, and oral sex. While HSV1 is typically associated with oral herpes and HSV2 with genital herpes, both viruses can infect either area. This is because the virus can be spread through close contact and the exchange of bodily fluids. Genital herpes is primarily spread through sexual contact. This means that the virus is transmitted from one person to another during intimate physical interactions. The virus can enter the body through the mucous membranes found in the mouth, genital area, and anus. Once inside, it can cause an infection that may lead to outbreaks of sores and blisters. This includes vaginal, anal, and oral sex with an infected person. It's important to note that the virus can be present in the genital area even if there are no visible sores or symptoms. This makes it possible for someone to spread the virus without even knowing they are infected. You can contract herpes even if your partner doesn't have visible sores or symptoms. The virus can be active on the skin and can be transmitted through skin-to-skin contact. This is why it's crucial to have open and honest conversations with your partner about sexual health and any potential risks. This is because the virus can still be shed even when there are no outbreaks. Viral shedding is the process by which the herpes virus is released from the skin or mucous membranes, making it possible to infect others. Shedding can occur at any time, even when there are no visible signs of an outbreak. You can get genital herpes from someone who doesn't know they have it. Many people with herpes are asymptomatic, meaning they do not show any signs or symptoms of the infection. This can make it difficult to know if you or your partner are at risk. This is because many people with herpes don't have any symptoms. They may carry the virus for years without ever experiencing an outbreak. However, they can still spread the virus to others during this time. Regular testing and communication with your healthcare provider can help manage and reduce the risk of transmission. It's important to practice safe sex by using condoms consistently and correctly. Condoms can reduce the risk of transmitting genital herpes, but they are not foolproof. The virus can still be spread from areas not covered by a condom. Therefore, combining condom use with other preventive measures, such as antiviral medications, can offer better protection. Genital herpes isn't spread through casual contact. This means that everyday interactions such as shaking hands, hugging, or sharing a meal do not pose a risk of transmission. The virus requires direct skin-to-skin contact in the genital area to spread. This means you can't get it from sharing utensils, hugging, or using the same toilet seat as someone with the virus. Understanding how genital herpes is spread can help reduce stigma and promote healthier, more informed conversations about sexual health. Always consult with a healthcare professional for personalized advice and testing. Genital herpes symptoms can vary from person to person. Some people experience painful blisters or sores around their genitals, rectum, or mouth. These sores may itch, burn, or tingle. Other common symptoms include flu-like symptoms such as fever, headache, and muscle aches, swollen lymph nodes in the groin, pain or discomfort during urination. It's important to remember that not everyone experiences noticeable symptoms. This is why it's crucial to get tested if you are sexually active or suspect you may have been exposed to herpes. Many people with genital herpes don't have any symptoms, or their symptoms are so mild they don't notice them. This is called asymptomatic herpes. Even if you don't have symptoms, you can still spread the virus to others through sexual contact. This is why regular STI testing is so important, even if you feel fine. It's important to talk to your partner about your sexual health. This includes discussing your STI status and getting tested together regularly. If you have any symptoms of genital herpes, see your doctor or visit a sexual health clinic right away. They will ask you about your symptoms and sexual history. They may also take a swab of the sores or blisters to test for the herpes virus. Blood tests can also be used to diagnose herpes. These tests can detect antibodies to the virus, even if you don't have any symptoms. Early diagnosis and treatment can help manage outbreaks and reduce the risk of transmission to partners. There is currently no cure for genital herpes. However, there are several effective treatment options available that can help manage the condition and improve the quality of life for those affected. Understanding these options can empower patients to take control of their health and reduce the impact of the virus on their daily lives. Antiviral medications are one of the primary treatments for managing herpes. These medications can help manage outbreaks and reduce symptoms, making it easier for individuals to cope with the condition. Common antiviral medications include acyclovir, valacyclovir, and famciclovir, which are often prescribed by healthcare professionals. These medications work by stopping the virus from replicating. By inhibiting the replication process, antiviral drugs can significantly reduce the severity and duration of herpes outbreaks. This means that patients can experience fewer symptoms and recover more quickly from episodes. This can shorten the duration of outbreaks and make them less severe. Additionally, consistent use of antiviral medication can help prevent future outbreaks, providing long-term relief for those living with herpes. Antiviral medications can also reduce the risk of transmitting herpes to partners. This is particularly important for individuals in intimate relationships, as it helps protect their loved ones from contracting the virus. Open communication with partners and consistent use of prescribed medication can greatly reduce transmission risks. Your doctor can help you determine the best treatment plan for your individual needs. This may include a combination of antiviral medications and other supportive therapies. Personalized treatment plans are essential for effectively managing herpes, as they take into account the unique circumstances and health status of each patient. Alongside medication, adopting certain lifestyle changes can also be beneficial. Regular exercise, such as yoga or jogging, can help improve overall health and well-being. Physical activity is known to boost the immune system, which can help the body fight off infections more effectively. This can include managing stress, getting enough sleep, and practicing relaxation techniques. Stress is a known trigger for herpes outbreaks, so finding ways to reduce stress through activities like meditation or deep breathing exercises can be very helpful. And eating a healthy diet. A balanced diet rich in vitamins and nutrients supports the immune system and overall health. Incorporating foods that are high in antioxidants, such as fruits and vegetables, can provide additional benefits. These changes can help boost your immune system and reduce the frequency and severity of outbreaks. By combining medication with healthy lifestyle choices, individuals with herpes can manage their condition more effectively and lead fulfilling lives. Preventing the spread of genital herpes involves responsible sexual practices and open communication with partners. Using condoms correctly every time you have sex can significantly reduce the risk of transmission. If you have genital herpes, it's important to avoid sexual contact during outbreaks. This is when the virus is most contagious. Talking to your partner about your herpes status is crucial. This allows them to make informed decisions about their own sexual health. Receiving a diagnosis of genital herpes can be emotionally challenging. However, it's essential to remember that you can live a full and healthy life with this condition. With proper management and the support of healthcare professionals, you can effectively control outbreaks and minimize the impact of herpes on your life. Remember, having herpes doesn't define you. By staying informed, seeking treatment, and communicating openly with your partner, you can navigate this condition and continue to live a fulfilling life.